Did you know that the very pills you take every day could be silently stealing your memory without you even realizing it? The truth is, after just 3 months of daily use, some of the medications you trust can severely shrink your brain, causing you to forget precious moments in life, moments you'll never get back. This isn't just a distant possibility. It's happening right now to millions of older adults around the world, and it could be happening to you too. You may think that these painkillers, sleep aids, or blood pressure medications are harmless, but a recent study shows that these very drugs could shrink your brain by up to 12% in just 3 months, and the risk of memory loss could increase by up to 80%. What's worse, most of us don't even know the damage they're doing to our brains. How is it that these drugs, which we take every day, are prescribed with little to no warning about the severe effects they can have on our memory and lives? We trust these medications without knowing they might be slowly destroying our minds from the inside out. It's time to take action. If you or your loved ones are using any of these medications, now is the time to stop and protect your brain before it's too late. In this video, I will reveal the dangerous drugs, the latest scientific studies, and most importantly, how you can protect your memory today. Before we dive in, if you haven't already, make sure to subscribe to the channel and hit the notification bell so you don't miss any critical videos that can change your life. If you find this video helpful, leave a comment below and share your thoughts. If you don't, leave a 0 so I can improve and make better content for you. Now, let's get started and learn how to protect your brain right now. Many of us, especially older adults, regularly rely on medications to manage issues like pain, anxiety, high blood pressure, or sleeplessness. However, what many don't realize is that long-term use of these medications can silently affect your brain health. So, how exactly do these medications impact our memory and cognitive abilities? Let's start by looking at one of the most commonly prescribed types of medication: opioids. 1. Opioids. Painkillers, oxycodone, morphine, hydrocodone. You may have been prescribed opioids like oxycodone, morphine, or hydrocodone after surgery or for chronic pain. These medications are very effective at managing pain, helping you feel better when you're going through a tough time. But there's something that many people don't realize. Long-term use of opioids doesn't just relieve pain, it can also affect your brain in ways you might not notice. While opioids are great at reducing pain, they also have a significant impact on your brain, especially on your memory and cognitive function. Studies have shown that long-term use of opioids can actually cause your brain's volume to shrink by up to 12%, meaning it can damage areas of the brain responsible for memory and thinking. Over time, this can lead to slower thinking, difficulty remembering things, and an overall decrease in brain function. Imagine this. You're managing your pain, but you're also forgetting important details about your life, names, conversations, or even special moments with family and friends. This isn't just about physical pain anymore. Your memory and relationships can be affected in the long run. What's even more concerning is that when you use opioids over an extended period, your brain becomes accustomed to the drug, and you may not realize the gradual decline in your mental sharpness. It can start with small changes, like feeling a bit foggy or forgetting simple details, but it can eventually lead to struggling to remember important events. If you or a loved one are using opioids for pain relief, I really encourage you to consider alternatives. It's important to talk to your doctor about safer solutions. Physical therapy, non-addictive painkillers, or even natural methods may help you manage pain without affecting your memory. Switching to a different approach may not always be easy, but protecting your memory and mental clarity is essential. Let's work together to find safer ways to ease pain without worrying about the long-term effects on your brain health. And just as opioids impact your brain, so do other medications like benzodiazepines, which are commonly prescribed to manage anxiety and stress. Let's now take a look at how these medications can affect your mind. 2. Benzodiazepines. Valium, Xanax, Ativan. Benzodiazepines, such as Valium, Xanax, and Ativan, are commonly prescribed to treat anxiety, stress, and to help with sleep. These medications work quickly and can bring relief during moments of high anxiety or difficulty sleeping. However, long-term use of these medications can have negative effects, not only on your emotions, but also on your memory and cognitive abilities. Benzodiazepines work by slowing down brain activity, which helps you relax and fall asleep more easily. But if used for a prolonged period, this calming effect can start to interfere with your ability to remember things. You might begin to notice that you have difficulty recalling recent events or feel a sense of confusion as though you're losing track of time or important details. Research has shown that long-term use of benzodiazepines can not only affect memory, but can also increase the risk of cognitive issues, such as permanent memory loss and diminished judgment. This can greatly impact the quality of your life, from your ability to work effectively to maintaining relationships with friends and family. If you are currently using benzodiazepines, I strongly encourage you to talk to your doctor about the possibility of gradually reducing the dosage or switching to safer treatment options. Remember, don't let these medications negatively impact your memory and the overall quality of your life. And much like benzodiazepines, muscle relaxants, commonly used to ease muscle pain, can have similar effects on your brain. Let's dive into how these medications can also influence your brain health and cognitive function. 3. Muscle relaxants, cyclobenzaprine, Soma, Flexeril. Muscle relaxants, such as cyclobenzaprine, Soma, and Flexeril, are commonly prescribed to treat muscle spasms and chronic pain related to muscle tension. While these medications help to relax your muscles and alleviate pain, they can also have some unintended consequences on your brain and cognitive abilities. When used for long periods, muscle relaxants can reduce your alertness and focus, leaving you feeling fatigued and distracted. Over time, this can make it difficult for you to concentrate on tasks, remember important details, or even complete everyday activities. This is particularly concerning for older adults, whose cognitive functions may already be in decline. You may find that you forget daily activities or struggle to remember key details about your work or personal life. These changes can significantly affect your quality of life, from your ability to function effectively at work to how you engage with your loved ones. If you are currently using muscle relaxants, it's important to discuss with your doctor about potentially switching to natural treatment options or physical therapy. These methods not only help alleviate pain, but also protect your memory and keep your mind sharp. Much like muscle relaxants, antihistamines, which many use for allergies or sleep issues, can also affect brain function. Let's explore how these common medications can impact your cognitive abilities and memory. 4. Antihistamines, Benadryl, diphenhydramine. Antihistamines like Benadryl are commonly used to treat allergies and to help with sleep issues. While they can provide quick relief from allergy symptoms and help you fall asleep, long-term use of these medications can have unintended effects on your memory and focus. Antihistamines work by blocking histamine, a chemical in the brain that helps regulate sleep-wake cycles. However, when used frequently, they can impair normal brain activity, making it harder for you to remember important things. This can lead to memory loss, where you may forget things you need to do or have trouble recalling key details from conversations. The cognitive decline caused by regular antihistamine use can impact your day-to-day life. You might find it harder to keep track of important tasks or feel disoriented when trying to remember simple things like names or appointments. If you find yourself regularly using antihistamines, it may be time to consider alternatives to manage your allergies or sleep without impacting your memory. There are other options that can help control symptoms without affecting cognitive function. Just as antihistamines can affect your brain, so can sleeping pills, which many rely on for a good night's rest. Let's now take a look at how sleeping medications can influence your memory and brain health. 5. Sleeping pills, Zolpidem, Lunesta, Temazepam. Sleeping pills, such as Zolpidem, Lunesta, and Temazepam, are often prescribed to help people who struggle with insomnia or poor sleep quality. These medications work by calming the brain and promoting relaxation, helping you fall asleep faster. However, while they may improve your sleep in the short term, using them regularly can negatively affect your cognitive function and memory. One of the most concerning effects of sleeping pills is their impact on memory consolidation. These medications interfere with your brain's ability to store and organize memories during sleep, which is essential for retaining information and processing new experiences. As a result, you may notice memory lapses or find it difficult to recall things you've recently learned or experienced. Furthermore, sleeping pills can also lead to grogginess or a sense of being foggy the next day, affecting your alertness and mental clarity. Over time, chronic use can even contribute to long-term cognitive decline, affecting your ability to perform daily tasks or make sound decisions. If you're using sleeping pills regularly, it might be worth considering alternative methods for improving sleep, such as cognitive behavioral therapy for insomnia, CBTI, meditation, or lifestyle changes that promote better sleep hygiene. These options can help you get the rest you need without the cognitive side effects. Just like sleeping pills, statins, which are commonly prescribed for lowering cholesterol, can also have an impact on your brain health. Let's explore how statins may influence your memory and cognitive function. 6. Statins. Lipitor, Zocor, Crestor. Statins, such as Lipitor, Zocor, and Crestor, are commonly prescribed to lower cholesterol levels and reduce the risk of heart disease. They are highly effective at controlling cholesterol, but what many people don't realize is that statins can also have an impact on brain health and cognitive function. One of the side effects of statins is their potential to reduce levels of coenzyme Q10, CoQ10, in the body, a substance that is essential for the energy production of brain cells. Without adequate CoQ10, your brain cells may not function as efficiently, which can lead to memory problems and a decrease in mental sharpness. Studies have shown that long-term use of statins may increase the risk of memory loss and cognitive decline, particularly in older adults. In some cases, statins have been linked to difficulty remembering names, appointments, and other important information. While statins are important for managing heart health, it's crucial to balance their benefits with their potential risks to your brain. If you're taking statins and notice any changes in your memory or cognitive abilities, talk to your doctor. There may be alternatives or additional treatments, such as CoQ10 supplementation, that can help protect your brain while still maintaining heart health. As statins can impact your cognitive health, so too can proton pump inhibitors, commonly used to manage acid reflux and stomach ulcers. Let's now take a closer look at how these medications might affect your brain function and memory. 7. Proton pump inhibitors. Omeprazole, Nexium, Pantoprazole. Proton pump inhibitors, PPIs, such as omeprazole, Nexium, and Pantoprazole, are commonly prescribed to treat acid reflux, gastroesophageal reflux disease, GERD, and stomach ulcers. These medications are effective at reducing stomach acid, helping alleviate symptoms, and preventing further damage to the esophagus or stomach lining. However, long-term use of PPIs can have unintended consequences on your brain and overall cognitive health. One of the most concerning effects of PPIs is their potential to interfere with the absorption of vitamin B12, a nutrient that plays a crucial role in maintaining brain health. Vitamin B12 is essential for the proper function of nerve cells and the production of red blood cells. A deficiency in B12 can lead to memory problems, confusion, and even neurological issues in the long run. Additionally, PPIs can also alter the balance of gut bacteria, which is closely linked to brain health through the gut-brain connection. Disruptions in gut health can contribute to cognitive decline and emotional issues, further exacerbating the risks of memory loss and confusion. If you're using PPIs regularly, it's important to discuss with your doctor about reducing their use or exploring alternative treatments for acid reflux and ulcers. There are other ways to manage these conditions without the potential cognitive side effects of long-term PPI use. As PPIs can have a significant impact on your memory and cognitive function, another class of medications, antipsychotics, can also affect brain health. Let's explore how antipsychotic medications, commonly used to treat mental health disorders, can influence cognitive abilities and memory. 8. Antipsychotic medications. Risperidone, olanzapine, quetiapine. Antipsychotic medications, such as risperidone, olanzapine, and quetiapine, are typically prescribed to manage mental health conditions like schizophrenia, bipolar disorder, and severe depression. These medications help to control symptoms such as delusions, hallucinations, and severe mood swings. While they can provide relief from these conditions, they also come with potential side effects that affect cognitive function. One of the most significant concerns with long-term use of antipsychotic medications is their impact on memory and cognitive abilities. These drugs work by blocking dopamine receptors in the brain, which helps reduce psychotic symptoms. However, dopamine is also critical for functions like learning, memory, and concentration. Prolonged use of antipsychotics can interfere with these cognitive processes, leading to memory impairment, difficulty concentrating, and slower mental processing. In addition to memory problems, antipsychotic medications can cause emotional flatness, making it harder for users to experience the full range of emotions. This can also affect decision-making and problem-solving skills, further diminishing the quality of life. If you or someone you care about is using antipsychotic medications, it's important to regularly review the treatment plan with a healthcare provider. There may be alternative options or adjustments to the dosage that can reduce cognitive side effects while still managing the mental health condition effectively. Just as antipsychotic medications can impact brain function, so can another class of medications, tricyclic antidepressants. Let's now take a closer look at how these antidepressants can also affect memory and cognitive performance. 9. Tricyclic antidepressants, amitriptyline, imipramine, doxepin. Tricyclic antidepressants such as amitriptyline, imipramine, and doxepin have been used for decades to treat depression, chronic pain, and insomnia. While these medications can be very effective for managing mood disorders, they come with a significant drawback: their impact on cognitive function, especially with long-term use. One of the key ways tricyclic antidepressants work is by altering the levels of neurotransmitters like serotonin and norepinephrine in the brain, which help regulate mood. However, they can also affect other brain functions, including memory, attention, and cognitive speed. Long-term use of these medications has been linked to an increased risk of memory problems, confusion, and a general decline in mental sharpness. For many people, especially older adults, this can result in difficulty remembering recent conversations, trouble following complex instructions, or even feeling disoriented in familiar environments. These cognitive issues may not be immediately obvious, but can accumulate over time, making it harder to complete everyday tasks. If you are taking a tricyclic antidepressant, it's important to discuss any cognitive changes with your healthcare provider. There may be alternative antidepressants or other treatments that don't carry the same cognitive risks. Now that we've discussed how medications can affect your brain health, it's crucial to recognize the early signs of cognitive decline so that you can take action quickly. Let's explore some of the warning signs to look out for, and what you can do if you notice them. Recognizing the early signs of cognitive decline is crucial in order to intervene as soon as possible. Cognitive decline can be subtle at first, and often people may not even realize the small changes happening in their memory and thinking abilities. If you begin to experience difficulty remembering recent events, such as forgetting where you placed your keys or misplacing items more frequently, it may be a sign to take note. Similarly, if you feel more disoriented when performing routine tasks or have trouble following conversations or instructions, these could be early warning signs. Other signs might include difficulty with multitasking, struggling to complete multiple tasks at once, or losing track of things you're working on. Repetition, asking the same questions or repeating stories without realizing it. Forgetfulness about familiar places or routines. Finding it hard to navigate to a place you've been to many times, or forgetting how to carry out familiar tasks. These early signs of cognitive decline can often go unnoticed, but they can slowly become more pronounced as time goes on. It's essential to inform your doctor if you notice any of these changes so that an assessment can be done. Early intervention can make a significant difference in how well you manage cognitive health over time. Taking action early gives you the best chance to manage or even reverse some cognitive issues before they become more serious. There are plenty of ways to support your brain health if you catch these issues early, and your doctor can help you develop a treatment plan that fits your needs. If you've noticed any of these signs, it's also essential to consider safer alternatives to the medications we discussed earlier that could be contributing to cognitive decline. Let's now explore some safer options to help improve and maintain your cognitive health. When it comes to managing your health, particularly with regard to cognitive function, there are safer alternatives available that can help support your brain without the potential side effects caused by long-term use of certain medications. 1. Non-pharmaceutical approaches. For conditions like pain or anxiety, there are natural therapies that can provide relief without affecting your memory. Practices such as yoga, meditation, and deep breathing exercises can help reduce stress and anxiety. Regular physical activity is another fantastic way to boost cognitive function, as it increases blood flow to the brain and promotes the release of brain-boosting chemicals like endorphins. 2. Cognitive behavioral therapy, CBT. For sleep issues or anxiety, cognitive behavioral therapy, CBT, has been proven to be just as effective as medications like sleeping pills or benzodiazepines. CBT works by helping you change negative thought patterns, which can help reduce anxiety, improve sleep, and enhance overall mental well-being without any side effects. 3. Supplements and nutrition. Certain nutritional supplements, like omega-3 fatty acids, vitamin D, and CoQ10, are known to support brain health. These can help with memory, focus, and even mood regulation. A balanced diet rich in antioxidants, like those found in fruits, vegetables, and whole grains, is also crucial for cognitive health. 4. Physical therapy. For those using muscle relaxants for pain relief, physical therapy is a great alternative that not only helps with pain management, but also strengthens muscles and improves mobility. This can help you avoid relying on muscle relaxants that affect cognitive function. By exploring these alternatives, you can help support your brain health, improve memory, and manage your symptoms more naturally, without relying on medications that may have long-term consequences for your cognitive function. Now, while these alternatives are great, it's equally important to discuss your medications with your doctor. Understanding the full scope of how the medications you're taking may be affecting your health is key to making informed decisions. Let's now talk about how to have an open conversation with your healthcare provider about the medications you're currently using. When it comes to managing your health and medications, it's essential to have open, honest conversations with your doctor. Your doctor is there to support you and ensure you're getting the best care possible. But they can only do so if they know exactly what medications you're taking and how they're affecting you. Chapter 1. Be honest about your concerns. If you've noticed any side effects from the medications you're currently taking, such as memory issues, difficulty concentrating, or feeling foggy, don't hesitate to bring these up with your doctor. Let them know what changes you've experienced and how it's impacting your daily life. It's important to be as specific as possible, providing examples of when these issues occur and how they affect your ability to function. 2. Ask about alternatives. If you're concerned about the cognitive side effects of a medication, ask your doctor if there are alternative treatments or lower-risk options available. There may be other medications or therapies that can help you manage your symptoms without impacting your brain function. 3. Discuss the benefits versus risks. It's also crucial to have a clear discussion about the benefits versus risks of the medications you're taking. Ask your doctor to explain how the medications are helping you and whether the long-term benefits outweigh the potential risks, especially when it comes to cognitive health. Understanding this balance will help you make an informed decision about your treatment plan. 4. Keep track of your medications. Make sure to keep a list of all your current medications, including over-the-counter drugs, supplements, and any prescriptions you're taking. This will help your doctor assess potential drug interactions and make better informed decisions about your treatment. 5. Follow up regularly. After your discussion, schedule regular follow-up appointments to review how your treatment plan is working. This gives you the opportunity to address any new concerns or changes you may experience. It also allows your doctor to adjust your plan as needed to ensure the best possible care. By having these discussions with your doctor, you'll be able to make more informed decisions about your health and treatment. Your doctor is your partner in managing your well-being, and open communication is key to ensuring you get the care that's right for you. As we wrap up, it's important to remember that your health, particularly your cognitive function, is crucial. The medications we use can significantly affect our brain, so understanding how they work and the potential side effects is key to making better choices. Let's take a moment to summarize and wrap up what we've discussed. As we've seen today, the medications we take to manage our health can have powerful effects, not just on our bodies, but on our minds as well. It's essential to stay informed and proactive when it comes to understanding how these medications might impact your memory, focus, and overall cognitive health. Recognizing the early signs of cognitive decline and having honest conversations with your doctor are key steps in protecting your brain for the long term. Remember, taking action early is the best way to prevent further complications. Don't wait until the effects become too noticeable or irreversible. Whether it's switching to safer alternatives, adjusting medications, or adopting healthier lifestyle changes, your brain deserves the same level of care and attention that you give to the rest of your body. If you found this information helpful and want to continue learning how to take control of your health and well-being, don't forget to hit that subscribe button. By subscribing to our channel, you'll stay up to date with all our latest videos, tips, and expert advice that can help you make better decisions about your health. Take charge of your health today, because your mind is worth it. Thanks for watching, and we'll see you in the next video.